Good afternoon. I'm Don Briggs, your mayor. Today is Thursday, April 23rd. Again, I'm joined by Commissioner Frank Davis, who along with Kathy Willits, our town manager, and myself serve as the town's COVID-19 response team. If you have any questions after today's presentation, the number is 240-446-4007. Text, and please, 240-446-4007. The town is still operating under a state of emergency and amendments as issued by Governor Larry Hogan. The stay-at-home, not mandatory request for non-essential service people is still in place. Face masks are required in public places, and that includes where we go for our essential needs and services, the grocery store, the pharmacy, the gas station. If you need a face mask, contact Vigilant Hose at 301-447-2728, 301-447-2728. As of this morning, the confirmed COVID-19 information for the state is 14,775 cases, 631 deaths. Frederick County, 658 cases, 29 deaths. The 21727 zip code has 9 confirmed cases. The Frederick County Health Department will not release any further details with regard to those cases. The town operate under what is called HIPAA, H-I-P-A-A, the Health Insurance Portability and Accountability Act, which was enacted in 1996 as a federal law that restricts access to individuals' private medical information. Again, we have no information on who they may be, who the cases were, and it's not available to the general public. If you are concerned about the 9 cases in our zip code, it's accountability, self-accountability, avoid interaction with others, do what we all have been told to do, stay in place, self-distance, wear a face mask in public places. Excuse me, Mr. Dick, I'm sorry, I'll give you a confidential. County Executive Gardner held a teleconference with the county mayors yesterday morning. Our town clerk was also in on the call. The state will still be proceeding with the distribution of the previous tranche, which, while preparing for the latest tranche, which was just announced this weekend, which is expected to be received Friday. Distribution of funds is still being finalized, but it seems the town will at least be reimbursed for personal protective equipment, which is called PPE. You'll see that on television. Staff overtime and comp time for the time period of March 1st through May 31st. A major concern was the impact of C-19 virus on our volunteer fire departments and emergency responders. With the cancellation of their fundraisers, it's putting a terrific burden on our volunteer service, and I think we're all aware of what Vigilant Hose has done for us in the last 45, 50 days, and this is, we want to keep our foot on the metal, down on the pedal here, and make sure that they get some reimbursement or all reimbursement so they can conduct their services to our community. Governor Hogan held a televised press conference yesterday afternoon at the reopening of a hospital in Laurel. Through the extraordinary effort of the governor and the First Lady of Maryland, Maryland is now in a very good position with regard to testing equipment. With the addition of the Laurel Hospital beds and those now at the Baltimore Convention Center, the ability to hospitalize those ill has improved immensely. Though things seems to be going in the right direction, the case curve has not leveled off. There is a formula that everybody seems to be working on and understanding that it's got to decrease for at least 2 weeks, and we have not reached the peak of that curve. No opening of business date has been set. To ready the state for reopening, the governor has announced the new program, the Maryland Strong Recovery and Reopening Plan. It consists of four points: extensive testing capabilities, capable hospital capacities, adequate PP&E supplies, and a robust tracing capability. The plan is to start the initiative next week. There is a website that if you want to follow the state more closely, it's coronavirus.maryland.gov. Tuesday, I spoke with Phyllis Kelly, manager of the Emmitsburg Food Bank. The food bank supply remains stable. To reiterate, we do have a backup plan if that does become unstable and they need restocking. Commissioner Davis will comment later on about information on Frederick County Health Department, Gettysburg Hospital, Frederick Memorial Hospital, and also I'd like him to talk a little bit about the what the effect has been on the ability of our volunteer fire department to raise money to sustain itself. Town office will continue to be closed to direct contact with the public. Town field and staff will continue to work on a rotating basis. Town offices will be open 9 to 3, Monday through Thursday, closed Friday, but there will be a staff member who will, be monitoring the phones on Friday. Water and sewer waste treatment plants are continually being supervised every day. We plan to hold a virtual town meeting at 7:30 Monday, May 4th, a special budget meeting at 7:30 Monday, May 18th, and a planning commission meeting is set for Tuesday, May 5th at 7:30. That also will be a virtual meeting. No updates on Dunkin' Donuts and Rutter's. As we understand, they are still working on their development plans through the county and the state permitting offices. We are still planning to hold a farmer's market this summer, and we'll have more update on that as we move into May. Yard waste collection site will be open on Saturday, May 2nd, 9 to 12. If allowed, we plan to reopen the town office Monday, May 11th at 8 a.m. Quarterly water, sewer, and trash bills will be mailed out on May 18th with payment due date of June 24th. To get back on our schedule, the next water, sewer, and trash bills will go out on June 30th. This is a compressed schedule. Please call our office if you have any problems with the payments. We will work with you. Let's work together on this. Jubilee, no change. Their service is the same. They're well stocked, exception for rushes on bread and toilet paper at time and other paper goods. They're doing a great job, and shipments are being made on schedule. Same goes for Med One and Dollar General. They are uninterrupted service, and staffing is much appreciated. Country Kitchen is continuing to prepare meals, and they've done it for the last 5.5 weeks, and it's estimated that about 3,000 meals, take-home meals, have been prepared there. The meals are being served at Vigilant Host, located near the square on West Main Street, Monday through Friday, 10 to 12. Also, there are food for kids. Weekend packages are available. The Frederick County School program is still going to have food at 11:30 to 12:30, Monday through Friday at Jubilee, and look for the yellow bus. Please continue to support our local restaurants. I know I say this every weekend, but it's much appreciated. The Carriage House Inn plans to resume service later in May. I talked to them yesterday. Our response team continues to work with our area partners, and also we're in contact with the county executive's office and her staff, and our town manager is also in contact with other county managers. Lots of people are doing lots of good things for us. Our first responders, doctors, nurses, pastors, Town staff and those who serve at Jubilee, the pharmacy, the gas station, our restaurants, please, please thank them. For local information with regard to the COVID-19 virus, please rely on town information sources. Please go to the town website, emmitsburg.gov, emmitsburgmd.gov, the town Facebook page. And our number is 301-600-6300. Vigilant Hose Company is 301-447-2728. Scams are up. Be careful. Everybody wants some of your money. Check with Vigilant Hose Company if you need a mask. At this time, Commissioner Davis, would you like to take the...
Sure, I'll just give you a few quick updates. Again, both hospitals, Gettysburg and Frederick, are doing well. As a matter of fact, I was in Gettysburg this morning at about 5 o'clock, and it was surprisingly empty, which is a good thing. And with the, even though the cases are spiking here in Maryland, the hospitalizations are down, so that's a good thing. Hopefully that's going to be something we can keep an eye on and watch go down. Unfortunately, we do have the 9 cases in the 21727 zip code, but that gives us a gauge, something we can watch now from week to week, because we didn't have any reports before, so we have no idea. We could have been at 8 for the last 2 weeks and didn't know it. Now at least we have a gauge, so let's kind of make that our goal, to keep that at 9. So next week when we're sitting here, we can say we're still at 9 and we're doing the right thing. As the mayor said, all nonprofits are suffering right now. That includes your churches, your veteran organizations, your Lions Club. All of those organizations are suffering. Because we've cut out all the fundraising, and we really don't want to compete with the restaurants right now for doing any type of food sales or things like that. I will tell you, for the fire department, we're doing very, very well. You know, they say there's always a blessing behind everything, and our merge 3 years ago has put us in a very nice financial situation, to where we're able to pay our bills and to keep providing a service. And we still have a couple months before we have to worry about our funding situation. So the fire department and ambulance is doing very, very well. Your churches, I know they're going to need their support. They live off the collections and things. So if you can you know, mail your offerings into them, I'm sure they would appreciate it, or any of the other nonprofits in town. I wish we had more good news to tell you, but just keep doing what you're doing. Fire and EMS calls in the county are down by about 40 to 50 calls per day. So that's all over the county that the calls are down. So that's a good thing. So hopefully that's another bright sign that things are going to get better here real soon. Again, if you have any questions, text them in to us real quick, and we'll try to answer them for you while we stay on the air here.
Thank you, Commissioner Davis. The best advice I can give you now is near the same advice I gave at the March 3rd town meeting. Stay calm, drink lots of water, stay rested, exercise, watch your diet, all as recommended by your physician. Add to that, stay at home, wear a face mask in public, and keep the 6-foot self-distancing. Know your risk, and that we all pose a risk to some others. And that they are those who may be in more risk than us. Don't miss this opportunity to call or do something for someone else who would really appreciate it. Thank you. If you have any text, please send them in. Thank you. With that, there are no texts, so we'll conclude our presentation. Thank you. We look forward to talking next week, probably about the same time, Thursday at 1 o'clock. Thank you. Have a wonderful weekend in this special place we live in. Thank you. Take care.